You're an expert in the field. You know everything there is to know. Well, maybe.
I doubt that,
and
but
people
go ahead.
ask you questions. They're looking for your advice, your expertise.
Yeah.
What is your learning? Do you continue learning, and how important is learning for you?
Great question. My learning is teaching, because I always learn from teaching, by listening to the questions, by thinking about it in a different way. My passion is, as maybe came through in the presentation, our National Pediatric Hypnosis Training Institute, and by thinking about that and by reviewing presentations that our faculty prepare, and they will tell you that I and my co-director are rigorous in our review of their presentations.
You never stop.
No, why would I stop?
That is wonderful. And the other question is, how do you think the technology has changed how we learn or how we teach?
Well, the technology has certainly changed. In preparing talks, I don't have to worry about the slides being in backwards and in the old days in a carousel. And I can show videos, which is remarkable, because I think that patients say this better than I do. And showing an amalgam of that is really important. The whole question of distant learning is a very curious question about, can you look at videos? Yeah, you can look at videos online. Can you have a dialogue with the patient or with the maker of the video online? Not so easy unless you have a live webinar. So that's challenging. I don't think we're there yet in understanding the best ways to do that. I've participated in giving webinars and doing them live, and the technology is not quite good enough yet so that, and you don't always get to see people. Although recently, I'll tell you a quick story. For many years at the university, I was part of, I had a grant for 15 years from the Maternal and Child Health Bureau to do what was called collaborative office rounds, pediatrics and child psychiatry. And we met every 2 weeks, and the whole idea was that the person presenting had to present a case or cases that were unresolved to ask the guidance of the colleagues in the community. And it was very successful, and it kept getting renewed. I say grant, this was like peanuts kind of grant, not NIH millions by any means. And so when I retired from there, that grant had to go to somebody else, and they've been doing it, and it's 40 minutes each way driving. So I hadn't been participating, although I get the notices. But recently, they changed, and they moved to a different room that now has state-of-the-art webinar ability, live video conference. And just for the last month, maybe 6 weeks, I've been going. It requires getting up early in the morning, but just going from my dining room to where my computer is, and turning it on, logging on, and there I am, live, in color,
amazing.
Microphone, video, with the rest of the people. And the audio is not perfect, but it's close enough, especially if they remember to talk into their microphones. And it's really been fun. And I missed it. So being back into it and not having to drive those distances, not quite like being there, but close.
Thank you. This is
So
wonderful.
does that get to the question?
Helps a lot.
Yeah,
Thank you
good.
so much.
You're welcome.